get into shaving the male patient. Shaving the male patient. So when we shave the male patient, we always want to check the doctor's order and make sure the patient is not on any anticoagulants. Anticoagulants are blood thinners. If the patient is on anticoagulants, we are not allowed to use a disposable razor. This can potentially nick the skin, break it, and the patient will bleed out, okay? So if the patient is on anticoagulants, we need to use an electric razor, okay? But if they're not, we can use a disposable razor. Mr. Smith is not on anticoagulants, okay? So Mr. Smith is in a 90 degrees, high Fowler's position. Mr. Smith can do some care on his face, but today he's feeling very tired, so I'm gonna do the care for him. I'm gonna assess the facial hair to see between the facial hair, make sure there are no moles, lesions in between the hairs, okay? Any infestations, I'm gonna assess that prior to getting started, okay? Remember that you are not allowed to shave off the beard or the mustache without consent. You can trim them, but you are not allowed to shave them bald unless they're already clean shaven. Like Mr. Smith is already clean shaven. He doesn't have a beard or a mustache. You can keep him clean shaven. But if your patient has a mustache and a beard, you're not allowed to trim it, to clean shave him, okay, without permission. So let's say he has some stubble here and we're going to get started. We always want to use a warm cloth on the patient's skin, okay, to soften the hairs so we can get ready to cleanse. We also want to provide a mirror for Mr. Smith so he can see how the shave is going along, okay? So we have our shaving cream of choice, okay? Mr. Smith has his own shaving cream, so we're gonna go with what he likes. And this is McKesson. All right, and we have our disposable razor. We can use this because Mr. Smith is not on any anticoagulants, okay? So we can remove the warm cloth. The skin is moistened, okay? So now we're gonna provide our shaving cream, okay? Now the patient can use a shaving cream of their choice, okay? So you apply the shaving cream, all right, to their facial area, all the way under here. Whatever area that you're going to shave, you're gonna provide shaving cream to that particular area, okay? Under here, it's fine with that. Right? Remember, if they're diabetic, we need to be very, very careful. It's preferred to use an electric razor on our diabetic patients because we don't want to take the chance of nicking them, okay? So we have our shaving cream applied to Mr. Smith. We have our water here in our basin, and we're gonna just wet our disposable razor. Now remember, you are to shave along the hairline, with the hair growth, okay? So we're never to shave upward, okay? Because this goes against the hair growth. It can cause major hair bumps. So we always go with the weight of the skin. So you should always taut the skin. Taut the skin is just to lift the skin up so it'll be nice and firm, okay? So I'm gonna go long strokes on this area of the face. Okay, cleanse, long strokes. Rinse, okay? Rinse, long strokes. How you doing, Mr. Smith? Okay, he's doing fine. Long strokes. All right. Now we're gonna get to under the nose area. So you can have Mr. Smith, let him know I'm gonna lift your nose up a little bit. And all of this area is short strokes, short strokes. Here, we're gonna rinse, short strokes under the nose, okay? Rinse, the chin area here, short strokes, straight down, okay? Under the neck, you have the patient lift their neck up, short strokes under the neck, short strokes, okay? And we're gonna rinse the other side. Here we can do long strokes, taut the skin upward, long strokes, on the chin here. Rinse. Okay, looks like we pretty much shaved every area. We're going to use our warm cloth and we're going to apply it to the skin, okay, to wipe off any excess shaving cream. Okay, I'm going to wipe off any excess shaving cream so we can assess the skin to ensure that there's no skin breakdown. Okay. All right, so we've cleansed the face. There's no skin breakdown. We've cleansed the area pretty well. Everything seems to be looking well on the skin. Okay, Mr. Smith tolerated it very well. He has no complaints. Okay, so we're going to document if there was a nick and there was a little bit of bleeding, if there was a mole or anything, any abnormality, we would document that. Okay, we would place the patient in a comfortable position. Okay, and that's pretty much it. Okay, thank you.